It's the Metro on WDET. I'm Robyn Vincent. We begin by thinking about those moments when you need some help. When you call 911 in Detroit, who's paying for the ambulance? It's a question that's tripped up the Detroit City Council twice in just a couple years. And the answer goes to a vote this afternoon. Now, Detroit pays 3 private ambulance companies between $500,000 and $600,000 each per year. That's to keep a guaranteed number of rigs staged in the city 24/7. It's called standby service. Run the math on the Heart EMS contract, and that comes to about $18.70 per hour per ambulance. Here's the catch. Those same companies can also bill you or your insurance when they pick you up. Councilmember Angela Whitfield Calloway has twice called that double dipping. But the Detroit documenters pulled the original contract documents and confirmed this is not a violation. It's how the deal is written. So what is Detroit paying for? And what does it say about American healthcare that a city has to cut million-dollar checks just to guarantee an ambulance shows up? Here to walk us through it is Noah Kincade, coordinator for the Detroit Documenters. They attend public meetings and document what leaders and residents are saying. Noah, welcome back.
Hi, thanks for having me.
Okay, so Noah, let's get some clarity because the public conversation has gotten murky. So the city pays each of 3 private ambulance companies, somewhere between $500,000 and $600,000 a year, as I mentioned. But that money isn't for ambulance runs. It's for what's called standby service. And this is interesting. I had to dig into this a little bit myself. There's a reason cities like Detroit lean on this kind of arrangement. Until the 1960s, almost half of America's ambulances were operated by funeral homes. And that's because hearses were the only vehicle you could lie down in. Wow. And then in 1966, federal standards changed. And ever since, cities have been figuring out how to guarantee coverage. So with all that said, what is Detroit actually buying with these contracts? And just as importantly, what is it not buying?
Yeah, I also had to dig into this a lot to understand this. What they're buying is, you called it standby service, and that's what the Office of Contracting and Procurement called it. It's what the fire department called it when they were at City Council trying to explain this to City Council members last week. What they're paying for is just to have the ambulances staged in different areas of Detroit so that they're there, they're ready, and they are able to respond within a certain amount of time. I think what Detroit is asking for is that they respond within 6.5 minutes. Okay. So, I'm sorry.
No, please.
So what they're not paying for, right, are the medical services that ambulance is providing. So, from the moment they pick a patient up to the moment they're passing them off to doctors in an emergency room somewhere, they're providing care, right? They're providing medical services. And that is not what these contracts are paying for.
Okay, so this is really kind of interesting because of the confusion among city council members themselves. And it also brings up the numbers, which are interesting. And with radio, we like to shy away from the numbers, right?
Sure.
Because a listener can't rewind and think about those numbers. So we're going to take this kind of slow for folks. So your team did the math on the Heart EMS contract.
Yep.
Over $573,000 a year for 3.5 ambulances staged in the city around the clock. That works out to be $18.70 per hour, which I mentioned at the top per ambulance. But now I want to put that into perspective for listeners. That doesn't even cover a single EMT's wages, much less the rig, the equipment, fuel, and a partner. So this standby fee is essentially like a retainer. It guarantees the city has trucks ready to roll, and the companies make their actual money on the rides themselves. So does that math hold up? And is that the deal Detroit thought it was making?
Well, I think it depends on who you ask in Detroit, right? If you ask the Office of Contracting and Procurement, yeah, I think that's the deal that they understood they were making. I think the fire department, based on what they said, I think they understood that was the deal they were making. I don't think that all the council members who approved these contracts understood that that was the deal they were making.
Yes, that brings us to a Detroit City Council meeting, Noah. This is Council Member Angela Whitfield Callaway in February of 2024. That was the last time these ambulance contracts came up for a vote.
I have a couple questions regarding these contracts. I had a few senior citizens to call me last week. They're being charged for ambulance services. I don't know why they are being charged if the city is paying for these services. So if we're paying for these services, are they going to residential properties? How is this contract laid out? I'm not understanding it because they're still charging. They even charged me when I had to have my dad transported.
Councilmember Angela Whitfield Callaway there back in February of 2024. And now here is Councilmember Callaway again. This is last Tuesday, April 21st, 2026. Same contract, 2 years later.
I brought this up a couple years ago when these ambulance contracts were before us. And I'm so concerned still that they are, to me, double dipping. We paid them to provide these services and they turn around and charge the senior citizens. And when the senior citizens' insurance don't pay, they go after the senior citizens and start to garnish their wages.
I hear Councilmember Callaway say double dipping, and I sort of recoil because she's putting out some misinformation here.
Yeah.
This is inaccurate. So 2 years apart, nearly the same words. Noah, your team caught this, the Detroit Documenters, because you have the receipts, the meeting archives going back years. What does it tell you that this conversation is happening almost word for word on a contract that's about to expire in less than a week?
I mean, it tells me that the council members are not getting the information they need, right? Someone who does understand this stuff needs to explain it and explain it maybe in a clearer fashion, in just a more direct fashion so that they understand. They need to understand what they're voting on.
You tracked down the original request for proposals from October 2023. Now, that's the foundational document for these contracts. There's a clause in there that I think a lot of Detroiters would want to hear, and it says the contractor may charge all users, patients, of their ambulance service according to a set rate and fee schedule as determined by the contractor. Now, this isn't unique to Detroit. After the 2008 financial crisis, private equity moved into the ambulance industry hard. And today, 2 of the 3 biggest air ambulance companies in America are private equity owned. And a University of Michigan study found that nearly 80% of ground ambulance patients are at risk of a surprise bill. So why was finding that document, that request for proposal, important? And what is that single sentence about charging all users? Right. What does that settle?
Well, it was really important to find the request for proposal. Shout out Kaylee Licklider for helping me track that down. The city doesn't necessarily post the actual contracts they signed. A lot of them are considered confidential. So to know what's in that contract, finding the RFP, the request for a proposal, is often your best bet. But that sentence is important because it actually does spell out that this contract is going to allow the contractor, or the ambulance provider in this case, to bill the patients, right? They have the right to bill the patients. What it doesn't settle, because I think it could have been worded more clearly, what it doesn't settle is what it is they're billing those patients for, right? As opposed to what the city is paying for. In researching this, I found a similar contract in the city of Novi that actually laid it out much clearer. And they said it is, the ambulance, it's that company's right to bill the patient for the medical services provided the patient, and that none of that would be the responsibility of the city, and the city would not be paying for that. It was much clearer reading that. So I think, maybe the RFP could be worded a little more clearly.
It's the Metro on WDET. I'm Robyn Vincent. My guest is Noah Kincade, coordinator with the Detroit Documenters. We're talking about Detroit's private ambulance contracts, what the city is paying for, what residents are getting billed for on top, and why the same debate keeps repeating itself at City Council. So we've been talking about an ambulance contract dispute, what the city is paying, like I said, what it isn't, what residents are getting billed for on top. But at the same April 21st meeting where we heard from Councilmember Calloway, Councilmember Denzel McCampbell stepped back and pointed at something bigger. Here he is.
I think this is another example of how a municipal government is trying to handle the costs around serving our residents and with our inadequate healthcare system. And just to bring this in, I think this is what goes to, as we talk about things like Medicare for all, that we talk about, that there needs to be a standardized service for folks when it comes to healthcare.
Okay, Councilmember McCampbell there naming what's underneath all of this. That what Detroit is wrestling with on these ambulance contracts is really a symptom of the inequality in the broader American healthcare system. I mean, when a municipal government has to negotiate standby contracts with private companies just to guarantee that ambulances are on the street, you're seeing a city that's trying to patch a hole left by the national healthcare systems. Right. From where you sit, Noah, watching this play out month after month at City Council, do you see other places where Detroit is being forced to absorb costs that the federal healthcare system has pushed downstream, essentially?
You know, I haven't really seen a lot of examples, or at least any that I can think of right now, that where the city itself is, the city government is kind of filling those gaps. But where we do see it a lot is at community organizations, other healthcare providers, universities, schools, churches, right, who are really out there doing what they can to try to fill some of these gaps. And the one that pops right to mind is the Wayne Mobile Health Unit. This is a service provided by Wayne Health, which is associated with Wayne State University. And they've basically got a fleet of vans that they go and they post up at different places, like almost every day around, every month of the year. These vans are in different places around the city, and they provide free health services. They do blood screening. They'll check to see if you have diabetes. They'll check your lipids, all the things you normally get when you go to the doctor. They can help prepare birth control plan. They can connect you with a primary care physician if you need, with specialists, with mental and behavioral health providers. And they're doing this all for free, and they're doing it like on location. They're going to where the people are. And I don't, would that be necessary if people could just go see a doctor, right? And yeah. I mean, this is the point is that they're providing these services for free.
And we should note, I mean, we've talked about this service from Wayne Health here on the show on the Metro, and it feels like something that can be really transformative for people yes. who, let's say, don't have access to reliable transportation, which we know right. a big chunk of Detroiters fall into that category. Have cars. Yeah. Right. And we don't have the kind of public transit that we know folks can rely right. on to make it to their doctor's appointment. So this is really an important conversation to have, that the city has been able to step up in certain ways. Mm-hmm. But Detroit is a poor city. And so we have to ask the question of how much can it step up, really? And, we know that something that's happening right now with these private ambulances, this is from that same document that you and your team dug up. Private ambulances working with the city of Detroit have averaged about 6 runs, per 12-hour shift.
Right.
So these rigs are not sitting idle.
No, they're busy.
And here's a piece of context worth knowing. The federal No Surprises Act in 2022, it banned surprise billing for ER visits and air ambulances. But ground ambulances got carved out, and Michigan's own law follows the same pattern. So basically, when a Detroiter gets a bill after an ambulance ride, this is not a glitch. It's the gap that the law left open. But again, what I've been hearing from you, Noah, is that this isn't clear to Detroit City Council. And At least Council Member Denzel McCampbell is noting some of these gaps.
Right.
Was there any other sort of acknowledgement from the council about this big gap, or does it still feel like major confusion?
No, but the thing that I was struck by is that, it sounds like Callaway, at least, like, and actually Councilmember Renata Miller as well, it sounds like there actually is some, well, first of all, like they were under the belief that this was providing the actual, like, paying for all of the bills for people to get an ambulance ride,
Wow.
right? But the second part of that is it seemed like that was what they wanted, right? So there could be some real desire there to actually pay for this service. But that, obviously that's a much larger contract. That's a lot more money. And like you said, Detroit is a poor city.
Noah, today, Detroit City Council is going to vote on this. If they don't, the ambulance contracts lapse on May 1st.
Right.
But the bigger story that you and the Detroit documenters have surfaced is, again, as you have just noted, that the public conversation about these contracts has been stuck on the same misunderstanding for 2 years. I think that's what I'm hearing from you right now. So what would you say to a resident who wants to get smarter about how their city council is working?
I would say become a Detroit documenter.
I mean, give us the quick spiel.
Okay, well, I'll tell you, if you want to become a Detroit documenter, we will pay you to attend city council meetings and other meetings. You can learn about how government works, and you will report back to us on it. And if you want to do that, we have 2 upcoming orientations in May, on May 27th and on May 30th. One is online, one is in person, and you can register for those by going to detroit.documenters.org/workshops.
And we will link to that at WDET.org. I mean, crucially, Noah, when Detroit documenters are doing this kind of work, they're informing the conversations that folks like you and I are having.
Yeah, we rely on them.
Right. And they're also informing conversations that local leaders have in the future. So this is a really important thing that you all are doing. Thank you for sharing some of your latest work. Noah Kincade, coordinator for the Detroit documenters. Again, we'll link to their archive of Detroit City Council meetings, including everything we discussed today, at WDET.org. And the council vote on these ambulance contracts is happening this afternoon. The Detroit documenters will be there.
We will.
Thanks, Noah.
Thank you.
It's the Metro on WDET. I'm Robyn Vincent. Coming up, since October of 2023, there's been an uptick of vandalism against mosques and reported discrimination against Muslims in America. We'll find out why and how people in the metro area are being affected. That's next on the Metro. Stay with us.